Thank you for staying with us. According to the Nigeria Center for Disease Control and Prevention, that's the NCDC, there have been over 1,141 suspected cholera cases recorded across 30 states in Nigeria since the 1st of January 2024. Now, cholera, which is a highly contagious and waterborne disease, has claimed the lives of several persons, especially in vulnerable communities. The United Nations International Children's Emergency Fund, that's UNICEF, has now issued a pressing call for enhanced measures to protect school children from this disease. Chief of UNICEF's Lagosville office, Celine Lafossiere, noted that there is an urgent need for robust sanitation practices, improved access to clean water, and regular hand washing with soap and water to curb the spread of cholera within schools. Now, joining us via Zoom is a resident doctor at the Lagos University Teaching Hospital, Dr. Lilian Ochayi. Good morning. Thank you for joining us.
Thank you so much for having me.
All right. Let's begin with UNICEF's call for the prevention of the spread to schools. How vulnerable are children to contracting these cholera?
Okay, thank you so much for that question. Children, as much as adults, are vulnerable to contracting cholera, but we see that children are more vulnerable because their immunity is not as developed, their defenses are not as developed as we adults, so they are more prone to having severe cases of dehydration from being infected. And, they're also in environments where they interact with their peers and they get to meet with a lot of individuals. So this puts them at risk of contracting this. And because their immune system is not as strong as adults are, so it's very important that we do what we can to prevent them from getting this infection as much as possible.
And how does safeguarding the schools relate to broader efforts in tackling the cholera scourge? We have some schools resuming today just after the Salah celebration. Is this enough ground to shut down schools?
Yes. So it is not really a good time because the holiday happened and then kids are returning to school from the midterm breaks. So because of this outbreak happening right now, it increases the chances of coming down with cholera because we don't know how, the homes that they come from, how they practice hygiene in their homes. So there's a higher risk of them transmitting this to their peers, like maybe through sharing water, of which the sources are unknown. And, they tend to share things a lot. So this increases their chances of getting it. So this is one reason why people are really worried that kids are more prone to having this right now, especially with schools just resuming.
Now, the sanitation of schools has been brought to the fore. There are some schools who do not have access to clean water as it is. There are those who would need to buy water, and all of this is also putting pressure on the resources of schools. Some schools who might want to cut corners. What can be done to ensure that we really ensure that the schools provide what is needed? And when we are talking about what is needed to ensure the safety of schools and the school children, you will help us perhaps talk to us what that should be and perhaps how schools can ensure that there is safety, and the states now taking responsibility of monitoring what schools are doing to ensure the protection of children against the spread of cholera.
Okay, thank you very much. So this still comes down to the basic preventive measures that should be taken. So in schools, the same thing we tell the adults and individuals schools also should ensure that they let their students know to wash their hands regularly, because this is one of the ways by which this cholera, the disease, can be prevented. Washing your hands regularly, and also making sure that they provide areas where these students can wash their hands. In the toilets, there should be basins to wash hands. There should also be different spots where there's running water and soap for these kids to wash their hands. So making sure that these things are put in place is a way by which the spread can be reduced significantly. For what the government can do, I believe that raising awareness, just like we're doing now, going into the schools and engaging them, letting them know the risk, letting them know ways that it can be prevented, letting them know the signs to look out for, because there could also be some kids, with symptoms that they don't pay attention to, and it could also spread. So making them know these things to look out for to prevent further spread is very important. So I believe that these are ways that it can reduce the spread.
And what are the potential consequences of not prioritizing school safety as it is, and also ensuring that the education system is strong enough to address some of these concerns, not just the cholera outbreak, but some other outbreaks?
Yes, the consequences are, if not, so presently we are trying to reduce the number of cholera cases, right? But in schools, if it is not well managed and the kids contract this or get this infection and then take it home, and then they spread it to the family members, and then from there, they go back out and spread. So this would in turn just, prevent us, it's going to hinder our efforts in, the whole outbreak and reducing the rate at which, it's spreading. So it's important that we let them know that washing your hand is very important right now. And also for kids, their water bottles, they should have their personal ones and not share. And also sanitation is also very important, because cholera thrives in areas where there's poor sanitation. So there are, serious consequences if we don't do anything about this. So.
Right. So let's perhaps look at the role of parents at this time, because it's also very critical. We're talking about the safety of their children as it is. Is there a role they can play to addressing this whole matter? Yes, they don't know what happens at the schools, the sanitation within the school and the provision of all that is necessary within the school is important, but how can they begin that process from their homes?
Yes, thank you so much for that. So from the homes, the parents are, their kids look up to them and they pick up habits from their parents. And, they really play an important role, because from at home, they can or they should tell their children, okay, these are habits that you should, pick up. And there's something going on right now to not get infected. You should wash your hands properly. You should make sure that you're not, taking water from your friend. You don't know what the source is. They don't just get food from from food vendors or areas that don't look clean. So these are the parents' role, really. They have to educate their children and tell them that this is something that they need to do to prevent them from being infected. And also, when they notice symptoms, there's also the oral rehydration solution, which parents can also do. to give their children to reduce the rate of dehydration. That is before they get to a hospital. And there's also ORS sachets that are being sold. So these are ways that parents can also come in to help their children, overcome this.
Right. I like the fact that you mentioned the matter of symptoms if they notice. So what should parents look out for in their children to be able to quickly identify that perhaps their child has contracted cholera as it is, and then what steps they can quickly take?
Okay, thank you so much. So we know that cholera is practically a diarrheal disease. So it mainly presents with diarrhea, that is watery stool. So when you notice that your child is having multiple episodes of watery stool, it could be, a sign that, okay, you need to do something about this. And it has a characteristic stool, which we refer to as rice water stool. It looks like the rice water after parboiled and, washing. It has that typical characteristics. So that is one way. When you notice that there's frequent stooling, some could also present with vomiting. And then over time, if it starts getting severe, there's now signs of dehydration because the body needs fluids. So when we lose them in excessive amounts in a short period of time, it affects the body, and it could even lead to death in hours if not managed properly. So it's important that when a parent notices this in their child, they do something about it by going to the nearest health center or hospital to seek medical attention. So those are the main signs. For dehydration, depending on how long the child has been passing this loose stool or vomiting, there could be other signs, lethargy, there could be sunken eyes, and just weakness and all that. So those are signs. But the main thing to look out for is the diarrhea. But still, there are lots of, about 80% of cases actually don't have 80% of cases actually are asymptomatic. They don't present with symptoms. But with children, they most likely would present with symptoms. But it's important to do something. Like I mentioned, the ORS. People can even do it by themselves at home by getting a liter of water, bottled water or boiled water, and putting 6 teaspoons of sugar and a half teaspoon of salt, and then mixing that, and you can give your child to replace the fluids that are being lost through vomiting or stooling.
And from your point, you said that 80% of cases are asymptomatic. How would this help in identifying cases in adults? That aside, let's also speak to the fact that there are still some persons who involve in self-medication. When they're going through some of these episodes, some have to go to or resort to alternative means. Let's speak to that fact.
Yes, we're Nigerians, we're die hard, we feel like we can manage things, and we usually wait till it gets to the point where we can't handle it, and then we're like, okay, now we need help. So, and I feel like, yes, poverty and some other things contribute to this, because a lot of people would want to manage things themselves before going to a hospital where they know it might cost them a lot. But now we know that cholera is being treated for free in government facilities. So that shouldn't stop anyone from going to the hospital. So we're letting them know. It's good that, there's this opportunity, and they should know that they should not just stay back home and wait till it gets worse, because like I mentioned earlier, in hours, it can cause death if not managed. If nothing is being done, if the patient is not being treated, dehydration can lead to death. So it's very important that we don't stay back home and try to manage this and, just, end up losing lives unnecessarily.
Right. And still talking about treatment, I'd like to understand where a vaccine stands. Is it for prevention or is it for treatment as it is? Because the availability of the vaccine is also critical as we're looking to stem the tide of the spread of cholera.
Yes, yes. Thank you so much. So for the vaccines, they are not for they're not used for treatments. They're mostly to prevent. But even at that, vaccines don't provide 100% protection against whatever infectious disease we're trying to prevent. They produce immunity up to some level, but not completely. So even with the vaccines available, you still need to practice proper hygiene. You still need to practice good sanitation and things like that. So it's good that people get vaccinated. It will help to some extent, but it doesn't provide 100% protection against cholera. So it's important that people know.
And some have argued that the spread is as a result of the lack of awareness